Welcome to the colonoscopy prep video. This video will help you successfully prepare for your upcoming colonoscopy appointment. First, you should be receiving a letter in the mail with instructions specific to your appointment. It is extremely important to save these instructions. I like to take a picture of the instructions, so I always have them on me. I've had some patients tell me that they add the dates and the instruction to their personal calendars to remind them. Finally, contact us if you haven't received the letter 1 month before the procedure. On the day of the procedure, you will need to have an adult driver at least 18 years old to stay at the hospital while you're having your procedure. The driver must be with you at check-in prior to your procedure and on discharge after your procedure. The driver should plan to stay at the hospital for at least 3 to 4 hours for your procedure. If you're taking a blood thinner, please follow the printed instructions that you received via mail from the GI Procedures Department. The instructions will tell you the number of days that you need to stop taking your blood thinner prior to the procedure. 7 days before the procedure. If you're taking aspirin, the 325 milligram dose will need to be decreased to 81 milligrams. This will reduce your risk for bleeding. If you're taking 81 milligrams of aspirin, please continue to take this medicine directly as prescribed. Do not take any iron supplements or any other vitamins. Iron supplements can turn the stools black, which can cause decreased visualization of your colon. 3 days before the procedure. You will need to avoid eating foods high in fiber, such as fresh fruits and vegetables. Even though they are healthy and taste yummy, they do not clear out of the colon quickly. 2 days before the procedure. You will need to stop eating all solid foods and start your clear liquids. You can drink any of the clear liquids listed on the instruction sheet you received from the GI Procedures Department. Please do not follow the instructions attached to the container of the GoLytely prep that you received from the pharmacy. You will be getting your nutrition and calories through what you drink, so please do not drink diet or sugar-free liquids. Do not drink red or purple colored liquids because they can be mistaken as blood during your colonoscopy. And remember, absolutely no alcohol to drink. The day before the procedure, you will need to continue drinking just the clear liquids, just as you did the day before. Drink at least 2 8-ounce glasses of any liquid from the instruction list hourly. This will help you clean out your colon better and you will feel more hydrated. Again, no solid food, please. When mixing your bowel prep, be sure to fill the GoLytely container to the filled line with water or flavored powder such as Crystal Light. Some people also like to refrigerate it to improve the flavor as well. At 4 p.m., take the 2 pills provided in your prep kit package and then start drinking your GoLytely until it is half gone. A glass every 15 minutes is the usual pace. Once you have finished half of the GoLytely, go back to drinking the clear liquids until you go to bed. The day of the colonoscopy. On the day of your procedure, finish drinking the remaining half container of your GoLytely 4 hours before your scheduled check-in time. Your check-in time is printed on your instructions. 2 hours prior to your check-in time, do not take anything except for your heart, blood pressure, seizure, breathing, and Parkinson medicines with just a sip of water. Please bring your inhalers with you. If you are diabetic, do not take any diabetic pills or short-acting insulin. This includes regular or aspart insulins. The morning of the procedure, take only half of your long-acting insulin. This includes NPH, Determer, or Glargine insulins. If you require blood work, report to the lab at the time printed on your instructions prior to your procedure. Your procedure will be performed on 3 North, that is located on the 3rd floor of the main hospital. The date and check-in time for your procedure is located on your instructions. Please call the GI Procedures Department if you have any questions.